370,000 people have so far received the jab for the COVID-19 vaccine since the country began mass vaccination on the 2nd of March. To tell us more, we're joined on the line by Ghanaian youth and social commentator Ahmed. Ahmed, a very good morning to you. Thank you for your time. An incredible milestone, 370,000 people vaccinated in a space of 2 weeks. How did this happen?
Yes, let me say a good morning to you and your listeners. It's very early here in Ghana. But coming back to your point, I think that Ghana has a history of vaccinations, and it's no surprise to us that we were chosen as one of the first countries to implement the vaccine program because of the kind of robust public health systems that we have had in place for some time. So if you follow the vaccination process, within the first 6 days of the rollout of the vaccine from the second, we had over 200,000 people that were vaccinated. Just like most African countries, there was that apprehension for people coming forward to get vaccinated because of the misinformation that comes with most vaccines. But I think that the Ghanaian authorities, led by the president himself, showed leadership by coming out first to get vaccinated. I think that built a lot of confidence within the Ghanaian citizens and then the populace. So you realize that the strategy was to get the political leadership, the religious leaders, and all other leaders within the cross-section of the society to get vaccinated. If you know, the Ghanaian health service system has a little above 100,000 workforce out there that was supposed to execute this vaccination process, and therefore the manner in which it was rolled out and the phases by which it was rolled out made it actually possible for most people to get access to the initial 600,000 doses that were made available to the country through the COVAX program. So I think that it's fundamentally the approach to it and the kind of vaccination history and platform that the Ghanaian government had provided over the years.
Let's talk about that vaccination history, because we know that the Ebola virus has had its destructive effects, which were long felt before coronavirus even reared its ugly head.
So, corona is a different kind of situation that we are being confronted with. But from the early 80s, you'd realize that Ghana had already rolled out so many vaccines, from measles to yellow fever to smallpox and all that. So most Ghanaians that are below 35 years have had the opportunity of being vaccinated. And for most district hospitals or the CHIPS compound systems that we have in Ghana made it easy for young people, mothers, to be able to take their kids there to get vaccinated. So the same system has existed over time. If you also know, in Ghana we've had that the outbreak of CSM on a regular basis. So on an annual basis, there's a vaccination system that is being kept in place for people to be able to access CSM vaccines, yellow fever vaccines, measles vaccines, and so on and so forth. So I think that setup was already available, and that's the coronavirus vaccination process just simply rode on that platform available. To talk about Ebola, I don't think that Ebola was really something that struck this country. It came into West Africa, but Ghana didn't really have that experience of Ebola. However, like I said, from the early 80s, Ghana has been able to put in place a very robust vaccination mechanism across the country, across the 16 regions of the country, to ensure that citizens get access to essential vaccination platforms across the country.
I do understand that Ghana did have its fair share of Ebola, but the government managed to act very swiftly because of the vaccination strategies that you speak of. Now, let's talk a little bit more about the actual process when it comes to who gets prioritized with the vaccine. Here in South Africa, healthcare workers are in the first phase, and then I understand that police officers will follow, and then those with comorbidities. What were those priority lists within Ghana for people to qualify?
Yes, I think the priority was the first group of who were the most at-risk people. People above 60 years, the police service, the security services, the frontline public workers that included the highest level of the executive. And you understand why the highest level of the executive, the legislature, and then the judiciary were being introduced into the equation. Reasons being that we needed to build confidence within the populace of the country, and most of the influencers that were in the society were either political figures. So they had an opportunity to take the first shot just to build confidence within the citizens. Then you came to the second line of people that qualified, that included. So beyond the health workers, the security system, and those that were in the front line in the fight against COVID, then the aged, those that were most at risk of contracting or dying if they actually contracted COVID. The second group of people that qualified also were the executive again, because the executive was broken down into two structures, where we had the highest level, the level 1, and then you had level 2 and the mid-level executives. And then you had the third phase that had the entire Ghanaian populace, the young people below the ages of 50 being integrated in the vaccination process. Remember that we were expected to have 2.4 million doses of the vaccine by the end of May, and that means that 2.2 million people are expected to be vaccinated by the end of May. But the country, the president himself has got a huge target. He wants 20 million people to be vaccinated by the end of the year, and that's a very ambitious plan. But moving forward, I think that so many other young people have been very eager to participate in the process, get vaccinated along the line. And I think that the system is created an opportunity to accommodate all these people.
Now, Ghana became the first country in the world to use drones to deliver vaccines to rural communities. How was that administered?
So the drone system is not necessarily applicable to the COVID situation. I think that the drone system was for essential medicines to go to the hard-to-reach areas. And if you follow the news, the government of Ghana had signed a deal that allowed the introduction of drones in order to take essential medicines to hard-to-reach areas, so that in the overseas communities and in very rural communities that were very difficult to reach, we had bases where the drones would fly from to deliver vaccines to overseas communities.
Okay, thank you so much for your time. We are out of time, but thank you for joining us and talking to us about the exciting strides as Ghana reaches 370,000 people in a space of 2 weeks when it comes to the vaccination rollout program. Ghanaian youth and social commentator Ahmed giving us a sense of how that process unfolded. Still to come.